Good afternoon. Thank you for joining us for the Navigating Through Flu Season and COVID-19 webinar. This training is hosted by the Ohio Chapter American Academy of Pediatrics and is part of the Parenting at Mealtime and Playtime program that is generously sponsored by the Ohio Department of Health. The Parenting at Mealtime and Playtime program launched in 2014 and has impacted over 85,000 children in Ohio by providing nutrition and activity education. PMP is transitioning away from a quality improvement project to an education-based training program. And this is the first training that is part of the series focusing on supporting well child visits during COVID-19. There will also be another series on practice management. And you can see those topics listed there on the flyer. In January, we will be launching a journal club for MOC credit, as well as a PMP toolkit. This toolkit will provide information on how to implement PMP in your practice. The next webinar that we have will be on promoting patient and family wellness during COVID-19 on December 10th at 12 p.m. You can register for this training using the same link that you used to register for this current training, and it's also listed there on the flyer. If you have any questions or you're interested in receiving more information about the toolkit or journal club, you can send me an email at amiller@ohioaap.org. We also have a variety of PMP resources that we've created for the Parenting at Mealtime and Playtime program. You can access these handouts on our Ohio AAP website, as well as the Ohio AAP PMP mobile app that can be downloaded on the Apple Store or Google Play. I will go over a few of our handouts that we have available at the end of the training, but we have some on specific topics such as food insecurity or picky eating, but we also have handouts on each specific age, as you can see there from the picture. A few Zoom tips before we get started. All attendee lines will be muted, and you can ask questions and add comments by typing into the chat box. Please don't share your video at this time, and if you have trouble hearing or seeing the presentation, please let us know in the chat box and we will get that fixed right away. And then Dr. Sarah Adams, the PMP Medical Director, will be presenting this presentation, and I will now let her introduce herself and we will get started with the training. Thank you all again for joining us, and we are excited to start the series.
Hi, good afternoon. And we do want to welcome everybody this afternoon. It's a beautiful day, so thanks for taking time out to join us. And please don't hesitate to put any questions you have in the chat, and we will have time. Definitely, we're going to have time at the end to go through the questions in the chat. And thank you, Alex, for going over everything. She's going to be viewing the chat box and answering questions too as we go, if appropriate. And so let's get started. I am Sarah Adams. I am a pediatrician with Akron Children's Hospital, and I work in our Hudson pediatric office. And I am going to be talking about flu, COVID, and what's a healthcare provider to do. I mean, this is, I don't think I have to explain to everyone joining us today that this has and will continue to be, as we head towards the end of 2020, so another couple months, that provides, as healthcare providers, some challenges. Next slide, please. So our objectives today is we're going to talk about flu, we're going to talk about COVID-19, we're going to talk about what makes them the same, we're going to talk about what makes them different. We're going to go over some scenarios. I know that in my practice, there's a lot of different scenarios about You know, I've been exposed, I've not been exposed, I have symptoms, I don't have symptoms, who to test, who not to test. How do I differentiate? Is this flu? Is this a cold? Is it allergies? Is this strep? So we're going to go over some different scenarios and talk about that. We're going to really focus on prevention and the flu vaccine, and then at the end give you some resources about how to support your offices and toolkits that also will provide some resources for you too. Next slide. So COVID-19 is caused by an infection with coronavirus called SARS-CoV-2, and flu is caused by infection with influenza virus. Next slide. And to quote Ara Christian, who is an interventional pulmonologist in Loma Linda University Health, the threat of flu paired with COVID-19 could be extremely dangerous. Using proper precautions and knowing the symptoms can help limit the spread. By not taking preventative measures, such as the recommended flu vaccine, the flu season and coronavirus pandemic could synergistically overwhelm the healthcare system. Next slide, please. Now, I've heard all kinds of different comments about, about this whole, as we enter into flu season. I've heard the words, it's going to be a twindemic, a double pandemic, brace for this collision, a dual threat, the perfect storm. And as I've mentioned already, 2020 is not your normal year. And therefore, what, kind of motivated us to create this webinar is that even in flu season, 2020 is not going to be your normal flu season. Next slide, please. So our goals here are to minimize the risks of coming down with flu and any other virus, including COVID, and making sure that we have the ways to test for both flu and for COVID. So we don't want increased cases of flu to overburden our healthcare system. This is a concern. It is a concern every year, but now that we have the concerns with COVID, that is a concern this year more than ever. We want to make sure that offices and hospitals are prepared for testing, not just for COVID, as we've been working on, but also for influenza, and we don't want to strain the testing capacity. The AAP this year, though, still recommends and emphasizes the same points that they have in previous years, that children 6 months and older should be vaccinated against influenza, especially in the setting of COVID-19 pandemic, to prevent co-infection and additional morbidity and mortality. Now, the big question though is, if someone gets flu, are they at more risk to get COVID-19 and vice versa? And you know what? We truly don't know yet. What's really interesting to think about is that we do know that there are certain behaviors that make people more likely to get COVID-19, influenza, or any other viruses, or even bacteria, such as, being at events, not social distancing, not wearing masks, etc. And those increase their risks of getting sick. But we also know that the preventative measures that people are putting into place and practicing, we might actually see less flu. So really, it's going to be interesting. And as I mentioned, 2020 is not going to be a typical year for us. Let's hope with prevention that maybe we'll see less flu. Now, the comment on the last part of this slide, that children are a key entry point for household spread, this is specifically actually for influenza. In past years, we have known this to be a key point for influenza. But we also know that the flu vaccine can make a difference. We know that the flu vaccine can decrease hospitalization in the past by 50%. So number one, getting vaccinated. Number two, continuing to social distance, masking, and all of these things can decrease our risks for any respiratory viruses, including flu and COVID. Next slide, please. So we have two viruses. What are their similarities? Well, we know that they are spread in similar ways. They're both spread by respiratory droplets. They're spread by coughing, talking, sneezing. And we also know that they can spread before symptoms actually appear. We know that antiviral medication, when given at the appropriate time, can or may, maybe not always, may shorten courses. And that we know that for both viruses that we treat by addressing the symptoms. Other similarities that they have are they both can cause fever, cough, sore throat, stuffy nose, shortness of breath, fatigue, headache, muscle aches. Their symptoms can be mild, they can be severe, and both can be fatal. And we know that they can also cause complications or secondary infections such as pneumonia, which can be viral or lead to secondary bacterial infections such as bacterial pneumonia, for example. Now, one thing I did leave out of this slide that you might question, and that is like the gastrointestinal symptoms. And I bring it up a little bit later, and that is that in children, it is not uncommon for both COVID and influenza to have some vomiting, diarrhea. You see that those gastrointestinal symptoms, but in general, influenza in adults, you don't get the gastrointestinal symptoms that you might more commonly see in children. So that's why that's not necessarily listed here as being common for both viruses. Next slide, please. So let's talk about flu, not COVID. So in previous years, we've known that it starts to increase typically in October and November, and usually peaks between December and February, and can last into spring as late as May. The incubation period is usually about 3 to 4 days after exposure. Symptoms appear sooner than they do typically with COVID, and I'll explain that more in detail when we talk about COVID. You're most contagious when you have influenza in the first 4 days, but you could remain contagious really for up to 7 days. And you usually recover within 3 to 7 days if there's no complications. Influenza antiviral medications are typically oral. And we have a preventative medication. So if you are in close contact and given appropriately by age and at a timely manner, there are options for a preventative or prophylaxis. We also have the flu vaccine, and there are certain complications that can be different for influenza compared to COVID. Next slide, please. Flu complications very typically can be pneumonia, as mentioned before, myocarditis, which is inflammation of the heart, encephalitis, inflammation of the brain, myositis, inflammation of the muscle, which can lead to even rhabdomyolysis, which is even more severe, sepsis, ear or sinus infections, and certainly we could see worsening chronic conditions, especially with asthma and heart conditions. Those at higher risk are over 65, under 5 years of age, but even under 5 years of age, those that are under 2 are even at greater risk, and pregnant women as well. And I did read recently that risk factors can even up to 2 weeks after you've had the baby, you're still at risk. Next slide, please. Now there's a lot of words here. And I know, and I'm not going to go through every single thing here. And I thought about condensing it and spreading it out, but it's just, this basically is a list of all the health and age factors that are known to increase a person's risk of getting serious complication of flu. And I even, I know it's kind of overwhelming, but I think what I really want to emphasize here is just how important prevention is, because it is a long list, and we know that if we can prevent, and we're going to talk about different things, of course, the flu vaccine, but in other things too, we know that, there's a long list, and including, the pediatric patients, as I mentioned here. What I do want to mention is the very last point at the bottom, and it says, although all children younger than 5 are considered high risk for serious flu complication, the highest risk is those that are younger 2 years of age, with the highest hospitalization and death rate amongst infants younger than 6 months of age. And what's really important to remember from the previous slide is that we cannot start vaccinating until they are 6 months and older. So if the highest hospitalization and death rates are in infants younger than 6 months, then we have to remember that preventing those around the, and working to do what we can to help those around those that are around 6 months and under children is really important. Okay, next slide. So what are the serious symptoms? I always get kind of like questions that are asked, like, when should I go to the emergency room, or when do we need to guide our patients? And with children, it's, if they're having increased work of breathing, of course, any type of cyanosis, like blueness of the lips, the face, if they're retracting, if they have chest pain, severe muscle pain, especially if a child refuses to walk. We all know children are very, very active. And so we know that if they're just laying around, that's typically not a good sign. If they haven't urinated, for 8 hours, if their mouth is dry, if they're not making tears, which is a really late sign of dehydration. So monitoring the urine output is really important. If they're not alert or difficulty waking, again, that's a very late sign. High fever is above 104. If the child is less than 12 weeks and they have any fever, and remember that a fever is 100.4 or higher, fever, cough that is worsening, or if they're worsening of their chronic medical conditions. Same with adults. Persistent pain or pressure in the chest or abdomen, persistent dizziness, confusion, inability to arise, seizures in both, if they're not urinating, severe muscle pain, weakness or unsteadiness, again, worsening medical conditions, fever or cough that has improved but then returns and worsens. These are all signs that things are not going well and they need to seek medical attention. Next slide. So I hear all the time, I think it's just a cold, or, how do you differentiate? And one of I love this little slide. So I think that we can even, first of all, symptom onset. Typically, if they have a cold, it's kind of a gradual onset. When somebody comes and says, they got sick, it just hit me. That's usually flu, okay? And typically with COVID, I think it's kind of the same thing. COVID can be gradual as well. If whereas flu is like, bam, it just comes on really quickly. Aches and pains, very often you see that with flu. With a cold, it's not as common. Same thing with chills. Common in flu, not as common with the cold. Fatigue, weakness, flu. Sneezing, usually you have sneezing with the cold. Flu, a very common thing with flu. I also want to mention too, with both flu and COVID, you know, I get a lot of people that come in and say, it's just my allergies, it's just my allergies. And although we're not talking about allergies during this discussion, I do want to mention that, you know, so I'll say, oh, okay, so you think it's your allergies, you know, do you have itchy or watery eyes? No, no, my eyes aren't itchy or watery or anything. You know, are you any puffiness of the eyes? No, no, no puffiness of the eyes. Like, is your nose itchy or the roof of your mouth itchy? No, I'm not doing that. Are you sneezing? And that's like, no, no sneezing or anything like that. It's like, is nose running, you know, and it's like they have no allergy symptoms. So, you know, you do have to decipher it. I'm not saying that you don't want to listen. You really want to listen to them because maybe their allergy symptoms are like this, or maybe it started out like allergy symptoms and now it's developed into something else. But remember that allergy symptoms sound like allergies, you know, and so it's if they're if they're having symptoms like that, then yes, it could be allergies. But with something like flu, they're typically it's sometimes they'll sneeze, but it could just be sneezing because of a little bit of the congestion, especially in little babies. Sneezing is kind of their way of blowing their nose, but it's not going to be a common thing that they do, you know, throughout the day. Chest discomfort, very common in flu. You might get a little bit of chest discomfort and cough with the cold. That is something that is a little bit more common. Very common to get the stuffy nose, the sore throat in a cold, sometimes with the flu, and headache, very common with the flu, more rare in a cold. So hopefully that kind of helps differentiate between that cold and flu. Next slide, please. So what flu tests are available? So we have the rapid influenza diagnostic test, which detect part of the viral antigen. And, you know, that's a nasal swab test that we do. It's typically a point of care test. The rapid molecular assays detect genetic material for the virus. There are several more accurate tests. Remember, there are false negatives. But the good news is that these tests are usually better at detecting influenza in children. So as healthcare providers for children and adolescents, you know, this is really good news for us. So I always tell people if it's positive, but you know, we feel really confident that it's accurate. If it's negative and you feel that they are, you know, it looks like flu, sounds like flu, acts like flu, you know, you have to go with your clinical judgment. Next slide, please. So influenza treatment and prevention. So it works best if you start within 2 days of their symptoms. And this is very, very important. It can lessen the fever and the flu symptoms, and it has been, and it may reduce the risk of complications. The trade name is Tamiflu, but you know, there is the generic version. I don't have any, the generic version. It comes in a liquid, it comes in a pill. It's twice a day for 5 days, capsule or liquid as mentioned. And then there's a 10-day prevention, 7 to 10 day prevention for 2 weeks and up. But you'll also see in a different slide, like the 2 weeks is by guidance only, and that is in certain conditions that are appropriate. Zanamivir, I'm really bad at saying these generic names, twice a day for 5 days. It's inhaled for 7 years and up, but definitely not for patients that are asthmatics. Peramivir is once by IV for 2 years and older. And there is the pill, the baloxavir, which is once by pill, 12 years and older, but it has many contraindications. So most people are using the oseltamivir, which is, the Tamiflu. That's really, what is more standard of care. But I wanted to present the others just for your information. Next slide, please. So how do we give it? I always have to remind myself how to do this. So I wanted to present it for you. If they're younger than 1, it's 3 milligrams per kilo per dose, twice a day for 5 days. If they're older than 1, the dose varies by weight, and this makes it so easy. So you can see by looking at the slide how to dose it. It's very easy, so you can do it quickly in your office. If they're greater than 40 kilos, it's 75 milligrams twice a day for 5 days, which is also the adult dose. And then prophylaxis actually can be 7 days. It doesn't have to be 10 days, which is what it was recommended previously. And then in infants, like I mentioned before, so it's really not recommended chemoprophylaxis for under 3 months of age, but between 2 weeks and 3 months of age in certain situations. So I would only treat under 3 months of age if guided by infectious disease in those situations. Next slide, please. Okay, so hopefully that was a nice overview of flu. We'll get back to flu and prevention some more. Now I'm going to talk a little bit about COVID, not flu. So one of the biggest differences with COVID-19 is that you get a change in or loss of taste and smell. And remember too, that sometimes what's a little tricky is that if you've ever had a cold, a really bad cold, things don't taste right. Of course, your nose is stuffed up, so maybe you're not smelling right. So, some people get a little confused about this, but it's definitely it's different than in that scenario when you have a cold. So there's a change in loss of taste and smell. You do not get that symptom when you have flu, but you may with COVID-19. You can have COVID-19 and not get that symptom, but that is a symptom that is specific for COVID-19 if you do have it. And then again, as I mentioned, you may have the gastrointestinal symptoms. And as mentioned before, that we do know that with influenza and children, that they also may have the gastrointestinal symptoms. And I'm not going to say that, never has an adult with influenza not had gastrointestinal symptoms. That can be a crossover symptom, but not as typical. The spread and infection with the virus typically lasts longer. COVID-19 has been known to be a super spreader, meaning that it spreads more quickly and easily. There are more complications, different complications, including blood clots in the veins and arteries, leading to strokes and heart attacks, and then the multi-system inflammatory syndrome in children. The incubation period is 2 days to 14 days. It usually, though, typically you develop symptoms within 5 days, but it can take up to 14 days before you see symptoms after you have been exposed. You can have very mild disease, and usually you are infectious up to 10 days, but more severe illnesses can be infectious up to 10 days or longer, or 20 days or longer. And you can have more long-term symptoms. There is a higher case of a higher fatality rate. And then there's the high risk and low risk symptoms. And what I mean by that is the high risk and low risk symptoms are like basically what that means is if you have high risk symptoms such as fever, chills, cough, shortness of breath, difficulty breathing, loss of taste, loss of smell, you're more likely to either, you have a higher risk of spread, you have a higher risk of complications, you have maybe a higher risk of, having a longer, infection, low risk or a higher risk of, if you have those symptoms, you have a higher risk of actually having COVID-19. So like if you have those symptoms, there's a greater likelihood that you have COVID-19. If you have sore throat, runny nose, muscle aches, headache, fatigue, abdominal pain, vomiting, diarrhea, those are considered low risk symptoms. It doesn't mean that you shouldn't be tested for COVID-19, but just having those symptoms, you're considered a lower risk of having COVID-19. But all of those symptoms are still considered symptoms consistent with COVID-19. And hopefully I explained that appropriately. Next slide, please. So Akron Children's, and I did get permission to share this, and the Ohio Department of Health and the AAP, we created this slide, and we did this like right before kids went back to school, but I still think it's relevant because we're constantly monitoring and following these kids while they're in school to just say, now a lot of, band is coming inside, for example, and, with different cases rising in different districts and zip codes. And I know that, certain school boards are still trying to decide, what we're doing. I think that this is a nice relevant slide, and what it shows you is what are the students' risks for COVID-19 exposure at school from low risk to high risk. And I think that, when you look at it, you can see, when you look at high risk, in-person activities, but without safety precautions. So like if everybody was going to class and there were no masks and no social distancing and, no washing of hands, and somebody was there with a fever or somebody was attending school with COVID-19, obviously that's a 5, and then as you go along, though, 4 is unmasked, using a water fountain, sharing school supplies without using disinfection, riding a bus without safety precautions. So, hopefully 4 and 5, nobody's doing that, and then, you start to get towards 1, 2, 3, and you start to say, okay, we're getting into the lower risk because if we are doing things like bringing your own water bottle to school, staying home when you don't feel good, in-person classes with recommended safety precautions, recommended safety protocols, staggering playground use, students moving, between classes with recommended safety, or maybe they don't, they don't move around, so there are ways to be able to do what we need to do so that we can lower the risk. And of course, virtual only classes present a very low risk. Next slide, please. So I wanted to present definitions because a lot of times people get confused between what's quarantine and what's isolation. And so an exposure, and what exactly is an exposure? Okay, so an exposure is if you have been in close contact with someone who has COVID-19 or presumed to have it. And this includes being more than, spending more than 15 minutes within 6 feet of them, or it could be a household contact or close physical contact like hugging, kissing, sharing, food and drink utensils respiratory droplet exposures like sneezing, coughing in close proximity, okay? Quarantining is a 14-day period, and this corresponds with that incubation period that I explained to you. And basically it's used to keep an exposed person from contact with others during that 14-day period when they could get sick during that incubation period. So that person in quarantine should remain at home and avoid contact with others to, as much extent as possible. An isolation is someone who either is a person who is sick with COVID-19 or presumed to be sick with COVID-19. And basically, we want them to be in isolation until they're no longer contagious. So it's 1 day resolution of fever, okay, and no symptoms. So it's at least 10 days onset of symptoms, okay? And this is referred to the 10 and 1 rule. So it has to be at least 10 days of onset of symptoms, and it has to be at least 1 day after resolution of fever. This person should have no contact with any other person or pets, with other people or pets. They should remain in their own room. And if it's possible, their caretakers should be masked, good hand washing, wiping down surfaces, doing the best you can, at home to isolate that person or child as best you can. So that's the difference between quarantining, which is basically quarantining a person who's had contact, to meaning that they've had contact during that time where they could develop symptoms, where they might get sick, versus isolation where they either have COVID or they're presumed to be COVID until they are no longer sick. Next slide, please. So what triggers a test? Well, anyone with high risk symptoms or low risk symptoms, so what triggers that? Anyone with high risk symptoms. So I mentioned those high risk symptoms: fever, chills, cough, shortness of breath, difficulty breathing, loss of taste, loss of smell, or change in those things. They really should be tested. Anyone with symptoms who's been exposed could trigger a test. Increasing symptoms or symptoms overlap. And I do want to mention, though, asymptomatic children or staff, like if we're talking about school or healthcare, do not need to be tested, or really should not be tested, and that's a tough one. I get a lot of questions about that, and that's really tough, just because that goes back to just not straining our testing our testing system. It's tough, though. You have to remember that things with COVID and the situation with COVID-19 is changing rapidly. It's a new virus, and we know that people do not have immunity yet. With influenza, even though we have to change the flu vaccine every year to tweak the immunity of the vaccine every year, because we know that influenza will, mutate and change, right? We all kind of have a little bit of immunity that we carry season to season. With COVID-19, we don't really have immunity. I mean, we're learning about the immunity. And so, and the vaccine is in development, and it's coming, and we're going to talk a little bit about that. And we're trying to estimate the mortality, and there's a lot of controversy about that, like, and trying to estimate, what's going on. But what we do know is that the mortality is substantially greater than flu. And we also know that it's made a greater economic impact than than flu ever has. So next slide, please. So I really I really like this algorithm that was created by one of our doctors at Akron Children's Hospital, Dr. Cooper White. And so they have COVID symptoms or they don't. So COVID symptoms, yes, no. Let's start with the no side. So COVID symptoms, no. Next question. Were they exposed? Yes, they were exposed at school. So the next question you have to ask yourself is, well, it depends on the level of contact with the school and what the public health response is regarding that. So the school right now has to report if the child has, if there's been any COVID at the school, but they tell the parents that they will be contacted if they've had direct or close exposure, okay? No COVID symptoms, known exposure, yes, it's ongoing and it's a household member. Well, then it's 14 days from the end of exposure. So for the family member that had it, they're at 10 plus 1 or 10-1 for the family member is isolated. But they could be they could be quarantined for up to 24 days because you have to keep adding up every time anyone in the family is develops COVID-19 in the family, if that should happen. So you kind of have to ante up their exposure and their quarantine time based on, you know, what their incubation period and their risk of getting sick is at that point. Known exposure, yes, one time, 14 days they are quarantined, even with no symptoms. So let's go back up to COVID symptoms. Yes, we have COVID symptoms, but no known exposure. We test them, they're positive, they are isolated for 10 days, and they have to at least be 1 day fever-free. We test them, they're negative. It says return to school, but what I do want to mention is that obviously we want to make sure that they're fever-free and that whatever else they had, because they had symptoms. So we want to, you know, did they have strep? Did they have influenza? Did they have something else? I mean, we don't want to send them back sick for whatever reason. Were they vomiting, you know? So they can return to school when appropriate. So COVID symptoms, yes, they have a known exposure. Now, here's the big thing. I always have parents tell me, well, you're making my child get the test. And I say, well, I'm not making you get the test. You have a choice. You can isolate them for 10 days or you can get the test. And so if they have a known exposure and they have, well, in this case, they have a known exposure, they can be tested. If they're positive, then they are isolated. If they're negative, then they're quarantined for 14 days. Test positive, isolated 10-1, test negative, quarantine. Known exposure, COVID symptoms. They don't want to be tested. They have a presumptive diagnosis. They are isolated. So this is a nice algorithm to kind of keep in mind. You're certainly not going to memorize it. You want to just, you know, kind of have it so that you can, you know, go through it based on what's going on. Let's say, again, going back to that scenario I was telling you, they have COVID symptoms, no known exposure. They don't want to test. They don't want to test. They're convinced that this is allergies. They want to know to go back to school. You have to tell them at that point that unless you have a clear cut reason, like absolutely 100% without a shadow of a doubt that this is not COVID, okay, that you can say when this child can go back to school, you could say they can isolate for 10 days or I can test them and we can see when they can go back to school. So again, no known exposure, yes to COVID symptoms. You could offer to presume the diagnosis and isolate them for 10 days or test them to see if they can go back to school sooner. Unless you have a clear-cut alternate diagnosis, that is really the only choice that you have. And I'm going to tell you, the families are not some families are not going to be happy with that, and I've run into that, but it's what we have to do. So, okay, next slide, please. So again, this is kind of like child's well, one-time exposure, 14-day quarantine. Child's well, ongoing exposure, 14 with a minimum 24 days, because if it's ongoing exposure in the household, again, child sick, no known exposure, you're going to test or you're going to isolate. School exposure, it'll depend on the level of contact. Child sick plus exposure, again, this is a tough one. You either presume they're diagnosed, isolate them. If not, if their test is negative, you quarantine them. Child plus others in the household, ongoing, different times of onset. Again, you've got to just kind of follow the family, but minimum 10/1. That past slide really goes along with it's kind of like a written out of the last slide with the algorithm. So what happens if a student, staff experiences COVID-19 symptoms? So stay home, contact the school, consult your physician, get a test, isolate, arrange for virtual learning, and then plan for a safe return to school. Next slide, please. What happens when someone doesn't experience symptoms until they're at school? So make sure that you're creating a process to address the symptoms, immediately isolate the person with symptoms, and then provide isolation instructions. Next slide, please. What happens when a person is exposed to someone who's tested positive? Quarantine for 14 days, monitor for symptoms. Next slide. What happens if someone tests positive for COVID but doesn't experience symptoms? Isolate, separate, contact the school. So they might not ever have symptoms, but they're positive, you've got to isolate. Next slide. What happens if a student or staff is asymptomatic but has been exposed to someone who has symptoms and who hasn't gotten the test results? Well, if they have high-risk symptoms, quarantine until the test results come back. If the test comes back positive, remain in quarantine for 14 days since the recent exposure of the person who tested positive. If it comes back negative, resume daily screening and activity as long as they don't develop symptoms. And any person who's having high-risk symptoms should be encouraged to be tested. Next. What happens when someone is exposed to someone who's exposed to someone who tested positive? So 2 layers removed. Continue daily activity. If you're exposed to somebody who's exposed to somebody, that's not direct contact. So it's 2 layers removed. So but you do need to also, you have to look at, again, what was the direct and how was the exposure? If you remember the slide, 15 minutes, were they masked, were they unmasked? Everything is an individual situation. So you really want to find out what was the exposure, what was the 2 layers removed? Was it somebody from a household, and so on. So you just try to get as much information as you possibly can. Next slide, please. So returning to sports is really important. And so if you have an athlete, it really comes down to, number 1, the age, number 2, the level of intensity of the sport. So all clinically confirmed or all clinical or tested confirmed COVID tests require a minimum of 10 days, 10+1 isolation after symptom onset or resolution of fever before returning to sports, okay? If they are non-hospitalized and they're under 12 and they have a low intensity, they need to come to the office and be cleared And they as long as they're asymptomatic, mild or moderate, then they shouldn't need a cardiology consult, diagnostic tests, or additional pre-participation evaluation other than your evaluation, unless clinically indicated, okay, by your exam or history. And you can advise them based on their symptoms to return to sports. Next slide, please. If they're non-hospitalized over 12 and they're in a high intensity competitive sport or activity, then they do recommend an EKG, a focused exam for history and their physical. And if it's normal, they can go to their sport. If it's abnormal, cardiology consult. So again, it depends on the age, it depends on hospitalized or not hospitalized, and the intensity of their sport. And then it depends on your history, your physical, if they're asymptomatic, infection, mild or moderate. Next slide, please. For hospitalized, no matter what age, no matter what sport, they recommend an EKG and a cardiology consult. Any patient with myocarditis, a recommended EKG, cardiology consult, comprehensive cardiac evaluation, and a 3 to 6 month exercise restriction. Next slide, please. And you recommend a graduated return to play for any age, for any sport, until fitness and strength has been returned to lessen the risk of post-return injury. They've been sick, they're weak. We want to make sure that they are not getting back into their sport too quickly to reduce injury. All non-COVID infections should be guided by previously established illness-specific returns. Next slide, please. So prevention. Wear the mask, physically distant. Stay home when you're sick. It's so simple, right? Limit contact with sick people. Thoroughly wash your hands and frequently, or use hand sanitizer if soap and water isn't available. Tell the kids, don't touch your eyes, your nose, your mouth. Clean surfaces. Use the crook of your arm or a tissue to sneeze or cough, and get that flu vaccine. So I, in my office, tell the kids how to use hand sanitizer. I remind them to get between your fingers, to get the backs of your hands. Don't forget your thumbs, okay? I tell them, pretend like you're a surgeon, and to do it. And how important it is to even get the tips of your fingers, okay? It's really important. Don't be afraid to demonstrate good hand washing and how important it is. Next slide, please. So cloth face coverings may help prevent people from COVID-19 and the spread to others. And we know that it can reduce the spread, not only of COVID-19, but I remember what I said, we might see less flu. Wouldn't that be wonderful? And it should not be worn in children under the age of 2, people who have difficulty breathing, anybody that's unconscious, incapacitated, or otherwise cannot remove their mask without assistance. And I love this slide where it just shows you, the airborne respiratory droplets, and we still do it through these masks. It's just much less than normal. Next slide, please. Physical distancing. So what does that mean? It's basically, keeping a safe space between yourself and others, at least 6 feet, indoor or outdoor. I think a lot of times we think, okay, we're outside so we can be safe. Know before you go. If you go somewhere, find out, I recommend really limiting going anywhere, but if you have to go to the store, grocery store, what precautions are they taking? For example, what are they doing to keep you safe? You want to know before you go. Prepare for transportation. Make sure you've got your hand sanitizer, you've got your mask, and eye covering. Limit contacts when you are running errands. Choose safe social gatherings or avoid them. and keep distance at any type of events or avoid events, especially now that we are getting into holiday season. You know, as healthcare providers, we need to stress the importance of, you know, the flu is coming, COVID is still around. You know, it is not based on popular demand. Now that we're still in the election, I should say, it's not going to go away. It is here. And also stay distance while you're being active. You know, it's very, very important that that this physical distancing is needs to be maintained. Next slide, please. Other good healthy habits: getting sleep, being physically active, managing stress, you know, drinking plenty of water, eating nutritious foods, good hygiene, oral hygiene. We have to brush our teeth. And then the alternatives, you know, I get a lot of questions about zinc, about drinking tonic water, about vitamin C and all those things. And, you know, here's the deal. I mean, I'm going to tell you, like, taking a vitamin every day, you know, absolutely, it's not going to hurt you to take a vitamin every day. But I'm here to tell you that it's really not, you know, going to prevent you from getting sick, but it's all part of the practice of good healthy habits. But nothing replaces eating a good nutritious diet, you know. So we want to really encourage them to eat a healthy diet, regular meals, encouraging our kids to eat breakfast. You know, we all know that as kids get older, especially into adolescence, that they stop eating breakfast. But we also know that if teenagers and our children eat breakfast, it helps with fatigue, it helps them think better, it helps with attention. There's so many things. So sometimes I'll just say, let's just start with eating breakfast, you know, and we also know that it helps us get sick less often. Next slide, please. So eating a balanced diet, we know it boosts our immune system. It makes us more efficient. Eating green vegetables enhances the proteins on our cell surfaces. It helps us, and by doing that, it boosts our immune system. Eat fruits and veggies, try to at every meal, you know. Get vitamin D, milk, eggs, egg yolks, salmon, mushrooms, canned tuna, beef liver. I know we probably can't get kids to eat beef liver, but I put it on there, you know. And so, you know, now in Ohio, obviously, although today is a beautiful sunny day, you know, so go out and take a walk, you know. It's we're going to see less vitamin D, but I'm just trying to say that, you know, and this is so important in our PMP program, and we have lots of resources that we're going to share with you. But a balanced diet is the best preventative medicine, and being active. So it's so important. Add color to your meals. Telling a child to eat the rainbow, you know, that's how you're going to get your range of vitamins and minerals and vitamin C. For adults, tell them skip the alcohol, you know, but don't skip meals. I tell kids 5, 4, 3, 2, 1, you know, 5 fruits and vegetables a day, 3 dairy, you know, at least, you know, 2 to 3 lean proteins, lean carbohydrates, healthy carbs, healthy fats, avoid sugars at 0 sugars, and no like fried foods or fats. Next slide, please. And keep moving. Ideally 60 minutes a day. Doesn't have to be 60 minutes all at one time. But even if we get our kids to walk 3 times a week, that is a plus. Any movement will help. It keeps inflammation down. It reduces stress. It increases our white blood cell circulation, which, guess what? Helps us from getting sick. And, you know, our new PMP webinars and handouts that are coming out in 2020 are going to be awesome. We're really excited about a webinar and a handout coming out in 2021 about playing inside. Next slide, please. We know that there's a connection between mental health and physical illness. We know that cortisol can make or break you. I always say the sympathetic system, which gives us our gas, and the parasympathetic, which is our brake. The sympathetic system is not so sympathetic to us, right? So that's our fight and flight. And we need to learn to engage our parasympathetic system. So how do we do this? By engaging our sympathetic system, our parasympathetic system, this helps with our immune system, okay, and helps fight infection, reduce our cortisol, take a walk, take a bath. Obviously, when kids are in the middle of class, they can't do either. So I tell them, you can breathe. And there's apps for these things that help these kids. There's so much anxiety, so much, and be social, which I know right now is so different. I just told you, you have to be physically distant, but we are going to, hopefully you'll sign up for one of our future webinars is going to be about staying connected during COVID, and we're going to help our kids and help our families stay connected during this time. Next slide, please. Practice good hygiene, okay? We talked about this. I think everybody knows this. So good hygiene, keep it personal. I tell the kids all the time, keep it to yourself. So your water bottle is yourself. Keep your utensils to yourself. Don't share food, don't share your mask. I think there was a funny meme about like kid coming home with a different mask on, because they traded it. And wash your mask. I saw a kid, just recently who had an infection behind their ear, and I think it might be just because they're either rubbing or irritation, but maybe they're not washing. I told them, I'm like, your mask is kind of like underwear. You gotta wash it every day and change it every day. So remind the families that they gotta wash their masks too. Next slide, please. And get enough sleep. 8 hours of sleep or more has been shown to improve resistance over viruses. And I know that this is a tough one, but it's so important. Next slide, please. So the flu vaccine, we know there's the quadrivalent, the trivalent, cellular recombinant base, and the live attenuated. And really the CDC recommends, any licensed age-appropriate flu vaccine with no preference for any one. And the one that we have now protects against 3 or 4 different viruses that the research has now said are the most common. Next slide, please. 6 months or older, takes about 2 weeks to develop immunity. When? Now. We started giving them in September, October, and we'll continue giving it as long as influenza is circulating. I mean, this says even into January. I know in our practice, we're going to give it probably through March, April, as long as we have supply. Its effectiveness is typically between 20 and 60%, depending on the predicting strains that's been in the past. Last year, it was over 50%. But remember that it will make the illness less severe. So even if you get flu, it will decrease your risk of serious illness. And it does not, absolutely does not increase your risk of other respiratory viruses, including coronavirus. Next slide, please. So let's help protect our patients. There's handouts, there's share, there's toolkits, social media, appointment reminders, and the CDC has a beautiful toolkit that we wanted to share with you about ways that you can encourage your families to get the flu vaccine. Next slide. So I love this, like how to make a strong recommendation, this SHARE. And what this means is share. So share the reasons why influenza vaccine is right for your patients. So, given their age, and, tell them it's just so important, and what the risk factors are, and all the things that we just mentioned. Highlight a positive experience with the influenza vaccine. Talk about something personal for yourself or something in your practice, and really reinforce the benefits to strengthen their confidence in, you know, in this vaccine. Like I'll share a lot of times that I got the vaccine and, you know, it went really well. And so far I've been giving it since September and no one's called to say that there have been any side effects. And this is true. Address their questions and concerns, you know, about the side effects, the efficacy, and the safety. Remind them that it protects them and their loved ones from flu and complication, and explain the potential costs of getting flu, including the seriousness of the illness. Next slide, please. So, I mean, this is how much COVID is changing, and this is about the COVID vaccine. So, even when I made this this presentation, this is where we were with the vaccine, and now I've been getting emails about registering for practices to be getting the vaccine in the office. So much is changing, and I know that the AAP is really reaching out to start trials for children, and you know, we're just stay tuned is what I want to tell you about the COVID vaccine. So next slide, please. Ohio AAP has a great resource toolkit for COVID-19 resources, including templates for letters, postcards, social media, and how to keep kids safe, communications to help us, help them, operations for planning visits to keep your office safe, support for families. I'm telling you, the toolkits are amazing, and I'm really excited about the toolkit we're preparing for you for PMP, because as I said, healthy lifestyle. I mean, we could go on and on, not just in preventing viruses, preventing headaches and migraines and stomach aches and better sleep and everything. It's just the foundation, okay? But these toolkits for COVID, I just can't say enough about it, because what is awesome about the toolkits is that, you know, and I know, we have limited time, right? We have so much to talk about with our families. These toolkits help you so you don't reinvent the wheel, so that you gain confidence, and so that you can provide these resources quickly and efficiently, and bam, you get the job done. Next slide. So back to concerns. It is possible that you can get both at the same time. We know that they both infect the lungs. We know that they are both serious for people that are at high risk. We don't want to strain the test supplies. A rapid test for both, well, we know there's one for influenza. We know there's one for COVID. There's some controversy about, you know, whether or not the rapid test, you know, has more false positives. This is starting to come out. The COVID vaccine, not yet available, not testing in kids, but stay tuned. Next slide. Testing options, you know, there's the PCR test is by far the best test. The respiratory film array, which does include many of the major respiratory pathogens. What I want to tell you about that is I think that that is a great test for inpatients, for the very sick. I don't really recommend that for your in-office test, but I think it's a really good test for those that are very sick. Of course, we have the influenza A/B antigen test, the RSV, and then the SARS-CoV test. You know, it does have major implications for individuals, families, and the community, but we talked about options and when to test, who to test. Remember that influenza testing and RSV testing, some limited therapeutic value. However, influenza in the first 48 hours can be helpful, because we know that we can treat with the antiviral to limit or lessen the fever and the viral load in the first 48 hours. Remember too that bacterial infections continue to exist, so you don't want to forget about that. Next slide, please. So I love this slide. It talks about, okay, you got your SARS test, your respiratory film array, your strep test, your flu, and then the stool culture film array. Again, if you look, severe respiratory, severe GI, that's when you want to do your film array test, whether respiratory or stool, and then the COVID testing, the strep testing, you know, the flu test kind of gives you a little bit of an idea of like how to, you know, kind of navigate through what test do I do, because you know, I didn't even mention RSV yet, you know, but that's coming too. So, for example, you have respiratory symptoms, mild, moderate, probably going to do a flu test if it's less than 48 hours, and a COVID test. You have, for example, a sore throat, and that's pretty much all they have. Then, depending on the age, you know, especially if they're older than 3, you're probably just going to do a strep test. Next slide, please. So there is a test that does a rapid test for both flu and COVID. The CDC has developed it, but it's in use right now for public health laboratories only, for spread and prevention. It does save time in testing materials, and it is pretty quick, but the FDA has given the CDC for just emergency use authorization only. It's not going to replace the tests that are in commercial labs, hospitals, or clinics, just for right now. Next slide, please. So I think that I have mentioned over and over and over and over, prevention is going to be the best way to fight this twindemic, this dual threat, this whatever you want to call it, that we are heading into. Let's hope that with prevention, it is going to be a milder flu season. I'm usually a pretty positive person. So keep washing your hands, keep wearing your mask, eat healthy, get plenty of sleep, reduce stress, emphasize this with your families. And if you have any questions, hopefully we have a little bit more time. I know it's such an important topic and I get really passionate about it. So I'm going to turn this over now back to Alex. And it's really been an honor to share this important topic with all of you today. Thank you.
Great. Thank you, Dr. Adams, for sharing that information. We have a few moments now for questions, and then I have some more information that I would like to share with you all. You can ask any questions in the chat box, and Dr. Adams will answer those for us.
I know there was one question earlier that I'll share with the group about the handouts being in Spanish, and we do have the handouts in Spanish as well. So, and I know Alex answered that, which is good.
Great. Well, while we're waiting for questions, if anything comes up, please let us know, but I will go ahead and share a little bit more about the PMP resources that we have available. We have a lot of handouts, a lot of new handouts. We will have new handouts coming this year as well on playing inside in the winter and during COVID, as well as a new handout on complementary feeding, specific around iron. So we're looking forward to including those handouts as well. A few handouts that we have available are on play, recognizing hunger cues, mealtime with the picky eater. These are some very popular handouts that we have. We also have one on breastfeeding. So the information varies depending on topic. We also have transitioning to solids, and then we have age-specific handouts all the way from newborn to 5 years, which is exciting. And then there's tips and self-care information and activity and feeding advice on each one of those age-appropriate handouts. which is great. And then at the top, it also includes weight and height. So if you print that out for your families, they can keep that as their child continues to grow. These handouts are also available on the mobile app, which is great. You can click on the age that you are interested in, and you will find these handouts there, as well as additional information that you think would be necessary. We have a tab specifically for COVID and some videos that Dr. Adams and some other physicians on our PMP advisory committee have created. So you can share those with families. You can refer to them when you're looking for some additional information. And that mobile application can be downloaded on Google Play or the Apple Store. And then we also have a program with Ohio AEP that is Parents Advocating for Vaccines. And since we talked about the flu and COVID, I wanted to play this short video for everyone really quickly. So that video was by Dr. Nicole Baldwin, who has social media outlets that she posts on about information in regards to vaccines and COVID, and it's just a great resource of information. So we're glad that she made that video for us. Oh, I'm not trying to play it again. Let's go to, so these are the resources that Dr. Adams used for this presentation. I will send these slides, and we also recorded this session. So if you would like to review it again or share with coworkers, anyone else, please let us know, and I will send this out via email. And then the survey for to receive a certificate or CME and MOC credit, I will send that out on Monday with the slides, the recording, any other information that you need. And if you need anything else from us, you can just let us know. And for questions, my name is Alex Miller. I am the program manager for parenting at mealtime and playtime. We are excited to launch these trainings and the PMP Toolkit and Journal Club. So if you're interested in participating or have any questions, please let us know. We're really excited about this transition. And again, we wanted to thank the Ohio Department of Health for their support and collaboration with this project. We hope everyone has a great weekend. And again, please let us know if you have any questions, and thank you for joining us on this Friday.